Hi everyone, my name is Nathan and I'm from the European Pain Federation. And today I'm joined by Professor Jan van Zundert. And today we're going to talk a little bit more about their plenary session at this year's EFIC 2023 Congress in Budapest in September. Jan, welcome.
Thank you very much, Nathan.
Thank you so much for taking time to speak to us today, of course. So we're going to give everybody lots of information. So do you want to just start off by introducing yourself?
Okay, with pleasure. My name is indeed Jan van Zundert. I am working as an anesthesiologist, pain specialist in Belgium, and since a couple of years also in the Netherlands. I'm chairing the Multidisciplinary Pain Center in Ziekenhuis Oost-Limburg, which is the eastern side of Belgium. And since 4 years, I'm combining it with chairing and full professor of pain medicine at the University of Maastricht, just across the border. In that way, we can combine the clinical work at the Belgian side and the scientific work at the Dutch side, and in that way improve translational and personalized medicine.
Amazing. And what's I guess you kind of probably touched on it already, but what's going to be the focus of your session at this year's Congress?
Okay, the focus of my lecture is my main interest also in the clinical practice and in research. So it's interventional pain medicine and trying to define, to try to get the best out of it, the best outcome out of it. And then we see it's in the evolution of personalized medicine. As we know, pain is still a problem because there is no diagnostic gold standard, and because of that, there is no real therapeutic miracle solution. So the different kind of treatments that we have to define and select as good as possible. Evidence-based medicine help in that. That's also already the first evolution of personalized medicine, and thanks to the research in genetics and the molecular biology. This can be improved in the future.
Amazing, really interesting stuff. So just a quick question about your recent paper in the European Journal of Pain, which some people will have read. You speak about delivering sort of evidence-based treatment protocols and process-based therapy protocols. Could you provide us with a short description of the differences and what that might mean for clinicians?
That's an evolution that we started already 10 or 20 years, or actually 20 years ago, but the most concrete was in the last 10 years that we updated always evidence-based medicine according to clinical diagnosis. If we look a little bit with an helicopter view on it, then we see that the evolution of evidence-based medicine and the evolution of pain medicine is quite parallel. Both of them started in the 90s, came up in the beginning of the century, and now in the last 10, 15 years, it's becoming more mature. And there is always a link between it. So when we are talking about interventional pain management, in the past it was most of the time related to techniques. But of course we are treating patients and not techniques. And a technique can be a help. It can be help in treating a patient. That's the reason that if we made the guidelines, we made them from the perspective of a clinical diagnosis or preferential clinical diagnosis from a patient. So that means that a technique for one diagnosis can have another evidence-based medicine rating than for another diagnosis. And that was the difference that we made in the last 10 years. We updated according to the great methodology, but we always kept that perspective of clinical diagnosis.
Okay. And how optimistic or how confident are you that we can, overcome certain challenges that will enable us to achieve, this goal of personalized care? What do you think? What do you think? How are we going to be able to achieve that, and how confident do you think we are to be able to achieve that?
That's a $1 million question, Nathan. And if we can answer it, we can go for the Nobel Prize. So the whole world is looking for it. But we don't have a choice. If we are honest, and we look at the literature in the last 20 years, so during the area of evidence-based medicine and pain medicine, the majority of the trials that have been done in treating pain patients was negative. Our pharmacological treatment was rather disappointing, and also in the interventional work, there has been quite a lot of negative trials. So if, of course, it's a whole multidisciplinary approach and the biopsychosocial approach and the support and the care of the patients, which is now a mainstay for advising our chronic pain patients. But in the meantime, it should be nice if we can go a little bit further and deeper in the results of treating the pain for the pain patient, because that's always also important. And if you see the amount of work and scientific work that have been done in genetic work in the last 10 years, and also molecular biology, at least we hope that there can be some advances to progress our results for the patients. And it's not in conflict with the care model and the biopsychosocial model, but it's an addition in trying to guide the patient as good as possible in the future.
And obviously that information, as much as it advances through, will then support the delivery of that multidisciplinary approach, the biopsychosocial approach, and that will really aim to supplement that, so we can give a well-rounded care to people with that sort of pain.
That's a nice conclusion, Nathan.
We try. Now, your chance to conclude. Why should people should attend your session this year?
We hope that we can give original information, because up to now this topic was never on a plenary lecture of EFIC. I'm very happy that we got the opportunity to deliver the message and to get a helicopter view and an overview of what has been done in this field in the last 10 years and what we can expect in the next 10 years. And therefore, I hope to welcome you all in Budapest, in the beautiful city of Budapest next year.
Exactly, and I'm sure everybody will. So it's some really, really interesting things that you're going to be talking about, and we're certainly looking forward to seeing you there. So again, thank you so much for talking to us today. Hopefully that's given people a little bit more information about the session this year. And we're really looking forward to seeing you at the Congress this year, and as you said, beautiful Budapest, and hearing more about your thoughts.
Perfect. And I realized that I said next year, but it's of course this year. It's after the summer.
It's coming around quickly.
We may not confuse the
people. Fantastic. Yeah, but we'll see you later on this year. And again, thanks for your time today.
Okay, thanks and all the best.
Thank you.